This is a picture of the arthrokinematics of the metacarpal phalangeal joint, but we want to emphasize here the reason for an immobilization position of around 70 degrees when you're trying to heal, say for example, a metacarpal fracture, and you have to hold the proximal and distal segments still while the fracture heals. So what we want to focus on is, well, first the range of motion we're trying to preserve, which is shown here. Flexion, and we have a roll and a slide that are similar because we have a concave on a convex surface. What we want to really notice is the shape of the distal head of the metacarpal. We notice here it's kind of an ellipsoid, so it rocks around, but its distance from the top or the posterior aspect or dorsal aspect of the metacarpal to the joint center versus the anterior or palmar aspect of the metacarpal to the joint center here, it's longer or a further distance in the anterior or palmar side. So since this is bigger, as you flex the proximal phalanx on the metacarpal head, just shown here, the distance or the stretch in the collateral ligaments, which are the main ligaments for the MCP joint, the collateral ligaments lengthen. And so a trick is, if you have to immobilize the MCP joint for some reason, is to immobilize it in about 70 degrees, 60 or 70 degrees of flexion, so you place the ligaments on stretch, or their maximum stretch that they'd have to be at, and that way when you are done with the immobilization, remove it, the ligaments will have been stretched the whole time, so you'll have plenty of range of motion in terms of those particular ligaments, and hopefully not have to go through the same length of rehabilitation you would if you had immobilized, say, an extension, for example.